Question 1. What is the appropriate PPE when caring for a patient on airborne precautions? A. Gown and gloves. B. Surgical mask and gown. C. N95 respirator and gloves. D. Face shield and gown. Answer. C. N95 respirator and gloves. Rationale. Airborne precautions require an N95 respirator to prevent inhalation of airborne pathogens like tuberculosis. Gloves are used when contact with body fluids is expected. A surgical mask is not sufficient for airborne pathogens. Question 2. When should hand hygiene be performed during patient care? A. Only after removing gloves. B. Before and after patient contact. C. Only when hands are visibly dirty. D. Only before a sterile procedure. Answer. B. Before and after patient contact. Rationale. Hand hygiene is a cornerstone of infection prevention and must be performed before and after every patient interaction to reduce the risk of transmission. Question 3. Which condition requires contact precautions? A. Tuberculosis. B. Measles. C. MRSA wound infection. D. Influenza. Answer. C. MRSA wound infection. Rationale. MRSA spreads through direct contact. Gloves and gown are needed. TB and measles are airborne, and influenza is droplet. Question 4. What is the correct order for donning PPE? A. Gown, mask, gloves, goggles. B. Mask, gown, goggles, gloves. C. Gown, mask, goggles, gloves. D. Gloves, gown, mask, goggles. Answer. C. Gown, mask, goggles, gloves. Rationale. PPE should be donned in the following order. Gown first, then mask or respirator, goggles or face shield, and finally gloves to ensure full protection. Question 5. What is the first action a nurse should take after a needle stick injury? A. Report the incident to the supervisor. B. Wash the area with soap and water. C. Notify the infection control nurse. D. Start post-exposure prophylaxis. Answer. B. Wash the area with soap and water. Rationale. Immediate washing reduces pathogen exposure. Reporting and post-exposure follow once the area is cleaned. Question 6. What is the priority nursing action for a patient with C. difficile infection? A. Use alcohol-based hand sanitizer. B. Place patient under droplet precautions. C. Wear gloves and gown during care. D. Administer antibiotics immediately. Answer. C. Wear gloves and gown during care. Rationale. C. Difficile requires contact precautions due to spore-forming nature. Alcohol sanitizers are ineffective. Soap and water should be used. Question 7. Which infection control measure is appropriate during central line dressing changes? A. Use clean gloves only. B. Use sterile gloves and mask. C. Wipe site with water and gauze. D. Change dressing weekly. Answer. B. Use sterile gloves and mask. Rationale. Central lines are high risk for infection. Sterile technique and mask use are necessary to prevent catheter-related bloodstream infections. Question 8. Which patient should be placed in a private room? A. A patient with COPD. B. A patient with neutropenia. C. A patient recovering from surgery. D. A patient with controlled diabetes. Answer. B. A patient with neutropenia. Rationale. Neutropenic patients are immunocompromised and need protective isolation to prevent exposure to infectious organisms. Question 9. What is the most effective way to prevent the spread of infection in healthcare settings? A. Wearing gloves. B. Using antibiotics. C. Hand hygiene. D. Using sterile supplies. Answer. C. Hand hygiene. Rationale. Proper hand hygiene is the most critical and effective measure to prevent healthcare-associated infections. Question 10. Which lab value would indicate the need for protective isolation? A. Hemoglobin 13.5G/DL. B. Platelets 250,000/mm superscript 3. C. WBC 1,000/mm superscript 3. D. Sodium 140 milliequivalent/L. Answer. C. WBC 1,000/mm superscript 3. Rationale. A critically low WBC count indicates neutropenia, requiring protective isolation to prevent infection from external sources. Question 11. What is the appropriate nursing intervention when transporting a patient with pulmonary tuberculosis? A. Apply surgical mask to patient. B. Place the patient in contact precautions. C. Do not allow visitors after transport. D. Transport with no mask but limit exposure time. Answer. A. Apply surgical mask to patient. Rationale. TB is airborne. Placing a surgical mask on the patient minimizes spread during transport. Question 12. When should transmission-based precautions be discontinued? A. When the patient's fever resolves. B. When symptoms subside. C. When lab results confirm no longer contagious. D. After 48 hours of antibiotics. Answer. C. When lab results confirm no longer contagious. Rationale. Precautions must remain in place until diagnostic testing confirms the absence of infectious risk. Question 13. What is the minimum time required for hand washing with soap and water? A. 10 seconds. B. 15 seconds. C. 20 seconds. D. 30 seconds. Answer. C. 20 seconds. Rationale. CDC recommends scrubbing for at least 20 seconds to remove pathogens effectively. Question 14. Which item must be removed last when doffing PPE? A. Gown. B. Gloves. C. Face shield. D. Mask. Answer. D. Mask. Rationale. Mask should be removed last to prevent inhalation of contaminants after other items are discarded. Question 15. What is the best action if a nurse notices a breach in sterile technique during a procedure? A. Ignore and continue. B. Report to supervisor later. C. Stop and correct the breach immediately. D. Document it after the procedure. Answer. C. Stop and correct the breach immediately. Rationale. Sterility breaches must be corrected in real time to maintain patient safety and prevent infection. Question 16. What is the appropriate PPE for caring for a patient with RSV? A. N95 respirator and gown. B. Gloves and surgical mask. C. Gown and face shield. D. Gloves, gown, and surgical mask. Answer. D. Gloves, gown, and surgical mask. Rationale. RSV is spread by direct contact and large droplets. Contact and droplet precautions are necessary. Question 17. What is the first step in cleaning up a blood spill? A. Wipe with dry paper towels. B. Cover with absorbent powder. C. Put on gloves and contain spill. D. Call environmental services immediately. Answer. C. Put on gloves and contain spill. Rationale. Safety and containment come first. Gloves protect the nurse, and containment reduces the spread. Question 18. A nurse should perform hand hygiene after which of the following actions? A. Taking vital signs with gloves. B. Removing a mask. C. Touching the bedside table. D. Adjusting the fore-pump. Answer. B. Removing a mask. Rationale. After removing any PPE, hand hygiene is necessary to eliminate potential contamination from hands. Question 19. What precaution is necessary when caring for a patient with herpes zoster shingles? A. Standard only. B. Contact and airborne. C. Droplet only. D. Protective isolation. Answer. B. Contact and airborne. Rationale. Disseminated shingles require airborne and contact precautions due to risk of varicella-zoster virus spread. Question 20. Which of the following is considered a breach in infection control? A. Wearing gloves during oral care. B. Reusing a disposable thermometer probe cover. C. Wearing a mask during suctioning. D. Changing linens for a soiled bed. Answer. B. Reusing a disposable thermometer probe cover. Rationale. Single-use items must not be reused. This practice risks cross-contamination and is an infection control violation. Question 21. What is the best way to prevent catheter-associated urinary tract infections, CAUTIs? A. Use sterile technique during insertion. B. Clean catheter with alcohol daily. C. Clamp catheter every shift. D. Irrigate catheter every 8 hours. Answer. A. Use sterile technique during insertion. Rationale. Maintaining a sterile technique during catheter insertion is critical to prevent CAUTIs. Alcohol is not used for daily cleaning, and routine clamping or irrigation is not recommended. Question 22. Which action violates surgical asepsis? A. Holding sterile objects above waist level. B. Touching sterile field with clean gloves. C. Opening sterile pack away from the body. D. Keeping sterile field in constant view. Answer. B. Touching sterile field with clean gloves. Rationale. Clean gloves are not sterile. Contact with a sterile field contaminates it. The other options maintain surgical asepsis. Question 23. What infection control practice is necessary when collecting a sputum specimen? A. Wear gown and sterile gloves. B. Use a face shield and gown. C. Use gloves and mask with face shield. D. No PPE is needed unless coughing occurs. Answer. C. Use gloves and mask with face shield. Rationale. Sputum collection may generate droplets. Mask and face shield protect against exposure. Gloves are essential for handling the specimen. Question 24. What type of precaution is necessary for meningococcal meningitis? A. Airborne. B. Contact. C. Droplet. D. Protective. Answer. C. Droplet. Rationale. Meningococcal meningitis spreads through respiratory droplets. Droplet precautions, including a surgical mask, are required. Question 25. A nurse is caring for a client in protective isolation. What item is appropriate to bring into the room? A. Fresh flowers and water. B. Fruits with peels. C. Disposable stethoscope. D. Room humidifier. Answer. C. Disposable stethoscope. Rationale. Protective isolation requires strict control of exposure. A disposable stethoscope minimizes infection risk. Fresh flowers, fruits, and humidifiers carry contamination risk. Question 26. Which action should the nurse take when removing gloves? A. Grasp the inside of a glove to remove it. B. Pull both gloves off at once. C. Remove the first glove by pinching the outside. D. Turn the glove inside out and place it on a clean surface. Answer. C. Remove the first glove by pinching the outside. Rationale. Proper glove removal technique prevents skin contact with contaminants and reduces cross-contamination. Question 27. What is the most appropriate disposal method for a used wound dressing soaked with blood? A. Flush it down the toilet. B. Place it in a paper bag. C. Put it in a biohazard bag. D. Discard in a regular trash bin. Answer. C. Put it in a biohazard bag. Rationale. Blood-soaked materials must be treated as biohazard waste and disposed of in designated containers to prevent exposure. Question 28. A patient with chickenpox is being admitted. What precaution should be implemented? A. Contact only. B. Droplet and contact. C. Airborne and contact. D. Standard only. Answer: C. Airborne and contact. Rationale: chickenpox is caused by the varicella virus, which spreads through airborne and contact routes. Question 29. When is it appropriate to use alcohol-based hand sanitizer? A. After using the restroom. B. When hands are visibly soiled. C. After removing gloves when hands are not visibly dirty. D. Before eating meals. Answer: C. After removing gloves when hands are not visibly dirty. Rationale: alcohol-based hand sanitizers are effective unless hands are visibly dirty or contaminated with spores. Question 30. What is the nurse's best response when a family member refuses to wear PPE? A. Allow entry without PPE. B. Educate about infection risk and enforce policy. C. Call security immediately. D. Ask the physician to speak with them. Answer: B. Educate about infection risk and enforce policy. Rationale: education promotes compliance. Enforcing infection control policies protects everyone. Question 31. What infection control measure should be used during tracheostomy suctioning? A. Clean gloves and mask. B. Sterile gloves and mask. C. Gloves only. D. Face shield only. Answer: B. Sterile gloves and mask. Rationale: sterile technique reduces the risk of introducing pathogens into the airway during suctioning. Question 32. A nurse notices that a coworker didn't wash hands after patient care. What is the priority action? A. Ignore it. B. Document the incident. C. Report the behavior immediately. D. Address the coworker directly and privately. Answer: D. Address the coworker directly and privately. Rationale: prompt, respectful feedback helps correct the behavior and reinforces infection control standards. Question 33. What is the main reason visitors are restricted in isolation rooms? A. To reduce noise levels. B. To conserve supplies. C. To prevent spread of infection. D. To allow the patient to rest. Answer: C. To prevent spread of infection. Rationale: visitor restrictions help control the transmission of infectious agents between patients and community. Question 34. A nurse performs hand hygiene and dons gloves before a procedure. What is the next step? A. Place sterile equipment. B. Explain procedure to the patient. C. Disinfect the patient's skin. D. Begin the procedure. Answer: B. Explain procedure to the patient. Rationale: patient education ensures informed consent and cooperation, which is essential before any intervention. Question 35. Which of the following actions increases the risk of healthcare-associated infections, HAIs? A. Frequent linen changes. B. Reusing gloves for similar tasks. C. Routine hand washing. D. Daily equipment disinfection. Answer: B. Reusing gloves for similar tasks. Rationale: gloves should never be reused. Reuse promotes cross-contamination and increases HAI risk. Question 36. Which of the following is a sign of systemic infection? A. Redness at foresight. B. Elevated heart rate and fever. C. Green drainage from wound. D. Warm skin around incision. Answer: B. Elevated heart rate and fever. Rationale: these are signs of a systemic inflammatory response, which may indicate sepsis or bacteremia. Question 37. Which action demonstrates standard precautions? A. Wearing gloves during oral hygiene. B. Wearing mask for every patient. C. Using gown with each medication administration. D. Isolating all patients with cough. Answer: A. Wearing gloves during oral hygiene. Rationale: standard precautions involve using PPE when exposure to body fluids is anticipated, such as oral care. Question 38. What is the correct step after exposure to a patient's blood through a cut? A. Finish the task before reporting. B. Wash area, report, and seek evaluation. C. Wait to see if symptoms develop. D. Cover wound and continue working. Answer: B. Wash area, report, and seek evaluation. Rationale: immediate washing and reporting allow for post-exposure prophylaxis and reduce infection risk. Question 39. What precaution is necessary when caring for a patient with influenza? A. Contact. B. Droplet. C. Airborne. D. Protective. Answer: B. Droplet. Rationale: influenza spreads through droplets. Surgical masks and droplet precautions are essential to prevent transmission. Question 40. What is the first step before entering a room with transmission-based precautions? A. Sanitize hands. B. Put on gloves. C. Check signage for PPE requirements. D. Notify infection control. Answer: C. Check signage for PPE requirements. Rationale: signage provides critical information about necessary PPE based on the type of transmission precautions in place. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!